Big changes could be coming to Michigan's mental health care system.
Republicans are pushing a pair of bills that recently made their way onto the Senate floor. News 8's Byron Tollefson heard from both sides of this debate and joins us now live from the newsroom with what he found out. Byron.
Brian and Sue, both sides agree the system needs work, including increasing the number of psychiatric beds and improving access overall. But how to get that done is another matter entirely.
After 2 years of a pandemic, the need is there. More people are seeking treatment for mental health.
We have more people coming in our doors asking for help than we ever have. We also have greater levels of need, right? People are really hurting right now.
2 bills currently working their way through the state Senate would privatize the state's mental health system. Insurance companies would control plans for Medicaid patients instead of public entities.
That are needed. Some of our most vulnerable residents are forced to navigate a disjointed and fragmented system.
Republican Senator Eric Nesbitt of Lawton says changing the system would give patients more choice.
Currently, I don't think that patients have enough choices to make sure that they're taken care of. And today's system benefits those, I think, with the financial means to navigate the systems, while those who lack the resources often suffer from inadequate care.
Opposing the effort, Julia Rupp, the executive director of Health West.
Now, if you walk in our door and you ask for services, it doesn't matter if you have Medicaid or if you have private insurance or if you have no insurance. We're going to provide that service to you, and we will bill the appropriate people to make sure that you get the care that you need.
She says that would change if these bills pass, decreasing access to quality care.
Insurance companies are going to manage the care by calling some nurse, probably in a different state, to say, do you authorize this service or not? That does not increase access. I think many people have experienced that with their physical health care before, where you're trying to get a medication, you're trying to get something that you know that you need, and your insurance company will say, well, no, let's try something else first because it's less expensive.
Nesbitt, on the other hand, says the bills would improve coverage for Medicaid patients.
Most Michiganders with private or employer insurance receives coordinated physical and mental health care coverage, and I think it makes sense that our Medicaid patients and those without the means have that same ability.
He says it would also strengthen the entire market.
I think providing more choice, providing some competition will help improve quality, will help improve services that are there.
Nesbitt says the bills are on the Senate floor, and he's hoping to see a bipartisan vote in the near future. A number of other mental health groups in our area oppose this legislation.